Hello, everyone. Welcome back to the Platform Century Talk Show. I am your host once again, in the person of Dr. Austin Oseke. Yeah, I'll be discussing with you today the topic that is most apt, a topic that everyone will benefit from, especially the men. The women will indirectly benefit from this also. It is not uncommon that men come to us and complain about inability to perform very well. Sometimes it is their wife that mentioned it. But I want to tell you, each time we get a case of somebody complaining about that, we have about 10 of them back there who don't have the courage or confidence to come out and complain, to say exactly what they are going through. So the topic we shall be discussing today, like I have stated, is erectile dysfunction. The question is, what is erectile dysfunction? We have to define it. Erectile dysfunction occurs when a man cannot get or keep an erection firm enough for sexual intercourse. Of course, erectile dysfunction can be a sign of a physical or psychological condition. It can cause stress, relationship strain, and low self-esteem, lack of confidence, and all that. The main symptom is a man's inability to get or keep an erection firm enough for sexual intercourse. Patients suffering from erectile dysfunction should first be evaluated for any underlying physical and psychological conditions. If treatments of the underlying condition does not help, medication and assistive devices such as pumps can be prescribed. But before we go further, I'd like us to look at one particular question that most people would want to ask. And it is about aging and sexual function. A lot of people excuse themselves when they notice that they don't perform well. They say it's because of age. But I want to, disagree to that, because the fact is, as you get older, health issues tend to increase, they tend to come up. But without the health issues, a man can be active into his 80s or even 90s. I know someone who in his 90, still performing well and well. So I want to dispel that notion or thought or belief or whatever you may want to call it, that age is associated with erectile dysfunction. So as we proceed, I want to go some ways into discussing this topic. It is not uncommon that we find so many therapies, drugs, quick fix solutions to erectile dysfunction. But I want to warn you, this might not be the best for you. A lot of times people may want to be disappointed at my approach towards managing erectile dysfunction. When you come to me, you might be expecting that I'll just prescribe something for you to take so that you'll be fine and get your sexual function, back. Of course, we are familiar with the term, the drug called Viagra. Most people in their 30s, 40s, 50s tend to use this drug, but a lot of them have had to regret this act, because when sexual dysfunction sets in and you do not fix what exactly is causing it, definitely you are driving yourself to a point where you become completely impotent. And that is what is happening to many people. So today, if you have any issues concerning erectile dysfunction, it's better to see your doctor, discuss with him, let him evaluate you and find out what exactly could be responsible. So in the light of this, I want us to take us briefly through the processes of erectile dysfunction. First, before you have an erection, you have to be turned on. When you're turned on, nerves fire in your brain. Then blood flows into your penis. If all goes well, you are ready for sex. But if it doesn't go well, then come along. Let's discuss why it might not go well. So sometimes it doesn't really go well. Occasionally, problems aren't anything that need treatment. You get that? Occasionally, the problems are not what really needs treatment. If issues happen more often, you may have erectile dysfunction. What we're saying is this: if you have it just once, it doesn't require any intervention. It has to repeat itself. It has to, reoccur, and it becomes an issue before you may require treatment. The reason is we are human beings and quite emotional. We could be going through certain things at the moment, and that might impact on our state of mind. And definitely, you don't expect to perform well. That is definitely a temporary thing. So you don't really need to bother. But then I have to warn you, there's what we call vicious circle. It may set in. When you get bothered by it and you get worried, that might trigger the onset of erectile dysfunction for you. So the very first time you experience, poor sexual performance by way of not having good erection or not maintaining it well, I want you not to take it into your mind, not to take it too much to your heart. Just take time, relax, It could be stress, it could be some other things going on. And definitely if those things are not things that are permanent or constant, you may just, get over it. So with that said, I want us to go through some of the causes of erectile dysfunction. I want to do this because I want you to have the right approach towards erectile dysfunction. And I believe by the end of this talk discussion, you may be better equipped and know how to approach it when next you have such issues or you find someone that has similar, someone in a similar situation. So the first I would like to discuss with you is stress and anxiety. Of course, it is the most common cause of erectile dysfunction. Your mind could be, quite occupied. When it is happening like that, then it is difficult to have sex because it is a mood thing. It is a mood thing. So try and relax, take some water, get some rest, calm yourself down, talk positive to yourself, rest well, sleep well, and you might just be fine, okay? Overweight is another thing that will cause it, and is a common problem, especially in the first and second world, not so much in the third world, because anyway, it is beginning to creep in. People are beginning to get overweight now because of their diet. So once that sets in, definitely you expect that your sexual function might be interrupted. Okay, so reducing your weight might go a long way to help, your sexual function, because you might be developing blood vessel diseases. And once you develop that, definitely your performance will run because your vessels need to be up and doing. They have to be working fine. They have to be very patent. They have to be, responsive to the stimulus, the reflexes that go on in the system. Where they are supposed to dilate, they should dilate. When they're supposed to contract, they should contract appropriately. When you are overweight and you start having blood vessel problems, you might start having issues. Of course, sedentary lifestyle where you're always having sitting, no exercise, your activity is so low. There is a common term we use to describe this where someone moved from an AC vehicle to an AC office, back to his vehicle, then home, everywhere he's just relaxed, takes his meal and sleep, Such a person is bound to have erectile dysfunction, okay? If you want to reduce your chance of having this condition, you have to get off your seat, do regular exercise, okay? And this can help, when it is time for you to have sex. It can help you perform very much better. Even your energy will be better to handle all the maneuvers you need to do. You know what I mean? Okay. Sometimes another disease will lead to erectile dysfunction. And these diseases include diabetes. This is quite common. Diabetes, has effect on the nerves. It's a nerve destroyer. So when you are having erectile dysfunction, it is good to check your blood sugar and be sure that it is normal. And if it is not normal, try to get it well controlled. In addition to this, we want to advise you to avoid taking, too much of sugary stuff, because when you take too much of sugar, your system can simulate a state called diabetes. That is a fake diabetes anyway, not the real diabetes. Okay. Kidney disease is also one condition that could cause erectile dysfunction. Your hormones, blood flow to your penis and your nerve system, all vital, for getting an erection. Okay. You can also sap your energy and sex drive. I hope you get it. So to have a good kidney function, is very, very paramount to good sexual function or sexual activity. Okay. Having said that, nerve and brain disorders, you can't get an erection without help from your nerve system. This is not possible. From your thoughts, from your sight, from your smell, you can be turned on. And as you get turned on, nerves are actually the medium. Information passes from one system to the other, and before you know it, you start having erection. So what are conditions that can be implied in a situation like this? Stroke is one of them. Multiple sclerosis, Alzheimer's disease, Parkinson's disease, all these disrupt your nerve functions. To an extent, diabetes is also involved, but not in such a manner, okay? Usually when you control your blood sugar, you might get better, but these conditions go far beyond controlling blood sugar. You might need some serious intervention to help the situation. And you could also be suffering from a condition that I would call silent stroke, or stroke that is not really manifesting. It takes a deep evaluation to discover that stroke. So that might be responsible for why you may not be having good, erection. Okay, we have blood vessel diseases. Sometimes you may not have issues with weight gain. You may not have diabetes, but then there's this intrinsic blood vessel problem. Some of them include high blood pressure, high cholesterol. Okay, these are common causes of blood vessel problems, and this might affect your sexual activity. Okay. Of course, in these situations, the blood vessels could be quite narrowed. And once they are narrowed, what do you expect? Poor blood flow. And that will undermine your erection, your libido, and everything. Okay, surgery is one cause. And this always comes to mind whenever we have to do an aneurysm, especially for men. When a man has hernia and he has to be operated upon, there is a nerve that we want to be careful not to touch. So, and for that reason, I personally would always want, a surgery to be done by two experienced people. And we say two heads are better than one. And that is what I do. Anytime I have to do aneurysm, hernia repair for men, I always work with a very experienced surgeon, and I know we can't go wrong. We just can't go wrong, because when that happens, you might take away the person's sexual activity for life. So I want to advise you that you know what to do at this point. Patronize the right places, see your doctor, discuss with him. You don't go after, cheap practices where things can really go wrong, okay? Please be careful about this. This is a major one. We have had instances where people, did operations, and when they're out of it, after recovery, they cannot perform. It's quite unfortunate. This is most difficult to fix. Okay, nerves and tissues needed for erection can be affected during procedures to treat prostate cancer or prostate enlargement or bladder cancer. All these operations around this area, they are very, risky operations. Of course, the problem often clears up, but it may take months. In some cases, the damage is permanent. If it is, there are treatments available to help you ready for sex, okay? So you have to meet your sex experts, you have to meet your doctors in case you're one of those in this category. Yeah, if it is a mere damage where we have contusion or distortion of the nerves or minor nerve injuries, you can recover within months. But if it is total, cut, total destruction of the nerve, then you may need some help, assistive help to get your erection back to normal. Okay, there can be injury to your pelvic area. This can be through accident, your bladder area, even spinal cord injury. There can even be direct injury to the penis. If you require surgery, you may get erectile dysfunction. You know what I mean here? If you have injury around your pelvic area, around this area that I'm circling, if surgery is done to help you, it could be that things have been damaged by the accident, by the injury, or the surgery that is done is responsible for the damage. So we never can tell which is which. But the thing is, once something disrupts that area, be rest assured that there could be challenges. So be well informed and be ready to face it appropriately. Just meet the expert for it. We could have venous leak. To keep an erection, the blood vessel flows into your penis has to stay a while. If it flows out quickly, you will lose erection. Injury or disease can cause this. Of course, for you to have a rigid structure, whatever is pumped inside must have the ability to stay for a while. If it leaks back because of some injuries to some vessels or for whatever reason, then you may have issues with that. Then talking about alcohol, tobacco, drug use, all these three can damage your vessels. They can damage your arteries. Smoking is one of the leading causes of erectile dysfunction. There are some prescription drugs that you may take that can affect your erection. Okay, even over 200 of them, At this point, it would be nice to speak with your doctor to handle the situation. If you start experiencing erectile dysfunction after starting a medication, then you need to report that quickly. One of the common examples we have are, high blood pressure drugs, antihypertensives. Some of them are known for causing this, even though they are not meant to cause that. They are known, to be responsible for this. So discuss with your doctor to get you an alternative, okay? Prostate enlargement, which we call BPH, benign prostatic hyperplasia. It's one of the causes of erectile dysfunction because when your activity around your penis, your urination is not normal, your life is distorted, even the passage of sperm is obstructed because of enlarged prostate. Everything is just messed up. You just realize that you're not playing your role very well, in that area. So you need to be managed appropriately. That is for prostate enlargement. Okay, a lot of men have dealt with or are dealing with erectile dysfunction. If you think you may have it, talk with your doctor and figure out the plan that best work for you. So at this point, I want to thank you for listening to me. If you think one of the things I have mentioned, is affecting you, try and see your doctor. If it is exercise issues, fix it yourself. Be encouraged to do that. Get a friend that will encourage you and make you active, frequently. And if it is a medical condition, surgical condition, discuss with the right person. So I want to leave you with this till I meet you the next time. Do have a wonderful day. Bye-bye.